Hi everybody, this is Dr. Britt Talley Daniel. I'm a neurologist and electromyographer. I'm a member of the American Academy of Neurology and the American EMG Society. And I'm a writer of 5 neurology textbooks. I've written a book on carpal tunnel syndrome, which is listed on Amazon. You can get it as a print book and as an ebook. I am going to hold it up now so you can see it. Looks like that. I'm writing a series of simple books on common neurologic clinical problems, and this is the second book in that series. If you go to Amazon and list my name, Britt Talley Daniel, in the search engine, the books will come out. And today I want to talk about, does use of the typing or use of computers cause carpal tunnel syndrome, which is a pretty common concept. I think really a misconception in the world literature, but I'll go into it here and you'll see where I am. Let's first talk about the difference between cause and aggravation. Cause means there's an etiology of something that's actually doing something to something to make it happen. So the cause of carpal tunnel syndrome is that persons are born with a small carpal tunnel, and that's congenital, and they're born that way. And the carpal tunnel is here at the wrist, at the crease, and the median nerve goes through there and into the fingers, mainly the first, second, and third digits, and it goes to the muscle at the base of the hand here, which closes the hand so you can touch the little finger and make a fist. So I'll show you a picture of what I think carpal tunnel might look like. It's just the OK sign is what I'm showing you. But if you can imagine, the nerve is going through the tunnel, and persons who have carpal tunnel syndrome have smaller tunnels, and women have 3 to 4 times more carpal tunnel syndrome than men do, and they have smaller anatomically tunnel than men do. Other things such as trauma or damage to the wrist, or trauma actual damage to the wrist, or edema fluid, like a lady when she's pregnant in the 3rd trimester, there's a lot of fluid in the hand, puts pressure on the nerve, and she can get carpal tunnel syndrome at that time, which usually goes away after she voids out all the fluid after the baby's born. Also trauma to the wrist, which causes scarring or bleeding, or protein exudates around the nerve, which later can scar and block the nerve. This is a median neuropathy. Neuropathy means damaged nerve, and the median nerve is the main nerve that goes through the hand for gripping and finger perception on the palmar surface. Now, I'm going to read to you this part out of my textbook just because it's all here and it's logical and it's pretty easy to do. So, who thinks that carpal tunnel syndrome is caused by typing? Well, American trial lawyers say that it's his clients, a poor, overworked secretary, typing all day long that gets carpal tunnel syndrome, or computer use, and that causes the symptoms. Really, we would say in that situation, typing or activities can aggravate the syndrome, make it worse. They don't actually cause it. It's not the etiology, but can make it worse and aggravate it. All right, so what's the deal relationship between carpal tunnel syndrome and computer users? I'm going to use Dr. Stevens, who's a retired neurologist, electromyographer for the Mayo Clinic, who's been really one of the most important writers for the American EMG Society on this subject in the last 20 years or so. And he wrote an article in 2000 in the journal Neurology on, and I'm going to quote the title of his article, "The Frequency of Carpal Tunnel Syndrome in Computer Users at a Medical Facility." And what Dr. Stevens did was he studied secretaries at the Mayo Clinic. So they did a survey of employees who identified as frequent computer users. And although 29% of the employees reported hand paresthesia, it means their hand got numb and tingly, only 27 of these employees, or 10.5%, met clinical criteria for carpal tunnel syndrome. And in 9 of these patients, that's 3.5%, the syndrome was confirmed by nerve conduction studies. Now, nerve conduction studies, or an EMG, is the test that's done to confirm the diagnosis of carpal tunnel syndrome. And you do it by putting a little electrode on the wrist and shocking the sensory nerve as it goes through here. If it's blocked or slow, or if the nerve to the motor nerve at the base of the thumb is blocked or slowed. That helps with diagnosis. And also a pin can be inserted at the thumb base to see if the muscle is getting adequate innervation. In Dr. Stevens' study, he found that affected and unaffected employees had similar occupations, years using a computer and time using a computer during the day. But he felt like the frequency of carpal tunnel syndrome of computer users was similar to that that's found in the general population. This is generally to be true. I'll show you another study on the same subject, written by Anderson et al., writing in the JAMA, Journal of American Medical Association, 2003. The title of their article was Computer Use in Carpal Tunnel Syndrome. They reported on questionnaires conducted in 2000 and 2001 at 3,500 workplaces in Denmark, studying the contribution of use of mouse devices and keyboards to risk of possible carpal tunnel syndrome with 1-year follow-up. They studied 9,480 persons and reached the conclusion that, and I quote, the occurrence of possible carpal tunnel syndrome in the right hand was low. The study emphasizes that computer use does not pose a severe occupational hazard for developing symptoms of carpal tunnel syndrome. I have one other article here from Migraine et al., who wrote in the Journal of Occupational Environmental Medicine in the year 2014 on, their title was, Is Carpal Tunnel Syndrome Related to Computer Exposure at Work? A review and meta-analysis, and they studied a bunch of databases, such as PubMed and things like that, and their conclusion was, quote, it was not possible to show an association between computer use and carpal tunnel syndrome, although some particular work circumstances may be associated with carpal tunnel syndrome. So the answer to the question I'm posing to start this talk is, no, carpal tunnel syndrome is not caused by computer use. It's found in people who biologically have a small tunnel, and that's it. I have another quote here about CDC guidelines, Clinical Disease Center guidelines regarding carpal tunnel syndrome. They say it can affect as many as 1.9 million people. Whoa, that's a large number. And 300,000 to 500,000 surgeries are performed each year for carpal tunnel release. Okay, the lifetime risk of symptoms of carpal tunnel in a specific person is nearly 10%, but women, as I've said, have 3 to 4 times the incidence of carpal tunnel. And it's because they have a small tunnel and they're born with it. It occurs mostly in adults and is rare in children or teenagers. There's a presentation of folks in their 70s and 80s who have severe carpal tunnel syndrome with severe median nerve demyelinating neuropathy with thumb-based atrophy. There's a muscle here, the base of the thumb is just gone. There's a hole in there. Or they may have decreased sensation for pinprick testing on the palmar surface. They can't feel a pin there at all. So it's called median sensory neuropathy. So a summary statement here that would be the following. Usually the syndrome of carpal tunnel syndrome results due to a combination of factors: a congenitally small carpal tunnel by birth, incidental swelling of the wrist due to sprain, trauma, or wrist fracture, diabetes, fluid retention, hypothyroidism, overweight, pregnancy, mechanical problems in the wrist joint, work stress with repeated flexion and extension movement, use of vibrating hand tools, or development of a cyst or tumor in the tunnel. Again, I quote from Dr. Stevens, writing in Neurology in 2002. The association of occupation and repetitive motion with carpal tunnel syndrome is controversial. Occupation that requires strenuous effort with high repetition, flexed or extended position of the wrist, and use of vibrating tools seems to be related. So vibrating tools, that's like the sidewalk dentist out there grinding up concrete with this vibrating machine. That's terrible for carpal tunnel syndrome. And I saw a patient recently who was burnishing, he was polishing a floor with a vibrating machine and a horrible carpal tunnel. Okay, understanding that most likely this syndrome develops in the hands of a person with small tunnels, the following is a discussion of activities that have been associated with carpal tunnel syndrome. So what I did here was, even though I had about 300 different articles in my bibliography I was looking at to write this textbook, it took me about 2 or 3 years to write it. During those periods of time, every time I saw an activity associated with carpal tunnel syndrome, I wrote it down. So here's a list on this. So anyway, persons who have high force, high repetitive manual movements, and I'm going to start listing things that are associated with this. Fix-it men, cooks, cashiers, typists, tin key operators, mouse users, assemblers, bookkeepers, welders and cutters, janitors and cleaners, bank tellers, data processors, construction workers, loggers, dentists. It occurs in musicians, guitarists, pianists, and violinists, athletes like tennis players, gymnasts, weightlifters, baseball players, bicyclers. It occurs with tendon rupture from sport injuries. In acute carpal tunnel syndrome, it can occur for wrist fracture with some sort of sport injury. Nonspecific tenosynovitis at the wrist. People who ride motorcycles, seamstresses, barbers, hairstylists, butchers, house cleaners, and gardeners. It's found in meat, poultry, or fish packers, frozen food factory workers, assembly workers, persons who use power tools or vibrating electrical equipment, and jackhammer operators at very high rates of carpal tunnel syndrome. Symptoms can be set off by a weekend of painting the garage, working the yard, or writing letters. It can occur seasonally as people use their hands, like women at Christmas wrapping presents and writing Christmas cards, students cramming for their final exams in January or May, accountants at April the 15th, business employees who input data or manually write into the month, into the quarter, or into the year reports. Certain hobbies are found with carpal tunnel syndrome. Persons who sew, knit, crochet, work in the garden, do needlepoint, woodworking, rowing, cooking, painting, drawing, bowling. I know it's a huge list, but I want to go ahead and give it to you. Writing, archery, fly fishing, carpentry, or play video games. It's found with certain medical conditions. I've said some of this earlier. Physiologic things like pregnancy, menopause, oral contraceptives, previous ovariectomy, a square-shaped wrist, short stature. Endocrine problems like diabetes, acromegaly, hypothyroidism. Anatomic things, persons who have persistent median artery that goes through the tunnel, thickened transverse ligament. Rheumatological problems like gout, rheumatoid arthritis, osteoarthritis, systemic lupus erythematosus, scleroderma, sarcoidosis, dermatomyositis, polymyalgia rheumatica. It can occur from trauma, distal radial, like the Colles fracture where you fall out with your hand out. A carpal lunate fracture, that's one of the little bones in the wrist, or dislocation. Neoplastic causes a ganglia, lipoma, a cyst, hemangioma, neuroma, Paget's disease, giant cell tumor of the flexor sheath, an angioma. Hematological problems, leukemia, multiple myeloma, hemophilia, amyloidosis, bleeding, eosinophilic fasciitis, bleeding into the wrist. Social problems like alcoholism, a dietary vitamin vitamin deficiency, and so it goes on and on. It's a long list of factors associated with carpal tunnel syndrome. So I'll end this by just saying good luck to all you who have carpal tunnel syndrome. I hope you have good treatment for this. Hope this sorts out your thinking regarding, does typing cause it? And I've listed a huge number of other occupations that can cause it. And the main problem is these people who get it have a small carpal tunnel. All right, thanks a lot and good luck to you all. Bye-bye.